question is, so when someone gets diagnosed and, for example, what does AskNomi bring to the patient, or what do you guys do?
Yeah. So there are two parts to this question. One is diagnosis itself. Like a few years ago, people were only getting diagnosed after they had gone through a laparoscopic surgery because that was the only way to definitively diagnose. And it still is the only way to definitively diagnose someone with endometriosis. But as recently as February this year, ACOG, which is American College of Obstetricians and Gynecologists, they've changed their guidelines on how you can diagnose someone with endometriosis by saying you can look at someone's symptom history, understand what their cycles look like, what their how they are presenting, and clinically diagnose them with endometriosis so they can start treatment sooner. Again, surgery is still a definitive diagnosis, but this is huge because there have been so many OBGYNs I've gone to myself personally that have dismissed that endometriosis. And they're like, it's not that common sort of thing. And now that's changing in doctors' offices so more people can get diagnosed. On AskNomi, what we are building is from tracker to virtual clinic. So for someone who's coming in with that question of, okay, I have migraines and pelvic pain, we have the entire journey from tracking your symptoms, uncovering patterns, and meeting with a physician who is endo-informed and can help you get that diagnosis and that clinical diagnosis and the next step. That is the pre-diagnosis pathway. But our goal is ultimately, we're not here just to diagnose someone, we're here to get them to better health. So how do we do that? We bring together evidence-based care in the form of group care. So we're doing virtual group care across mind, body, and movement that has evidence and research to help with endometriosis symptoms. So pelvic floor therapy is one of them. We know that a lot of breath work is related to nervous system regulation, which is related to managing endometriosis symptoms. And in that similar vein, you also know that nutrition and following specific diets could help with reducing inflammation overall and help with endometriosis symptoms as well and get to better outcomes.